Our presentation is on spinocerebellar ataxia, and the group presenting it is Gabriella Hayes, Elizabeth Thornton, and Marissa Taken. The causative agent of spinocerebellar ataxia is mutations in multiple genes. In some cases, the genes to cause this disease have been determined, but it is still unknown in around 25% to 40% of the cases. Spinocerebellar ataxia can be inherited through autosomal dominant genes. An autosomal dominant gene is a gene that is dominant, meaning it only requires one copy for mutation to occur, compared to a recessive gene which requires two and is not located on a sex chromosome. This way of inheriting this disease is due to trinucleotide repeat expansions, which is a segment of DNA repeated an amount of times. Note that this is normal to occur in the human body and does exist without causing mutations normally, but what causes spinocerebellar ataxia from these repeats is when the number of repeats is higher than normal, which causes an interference with the function of the gene. Trinucleotide repeats are passed from parent to offspring, where they can change in length and become unstable. This greater than usual number of repeats leads to more severe and onset at a younger age.
Signs and symptoms of spinocerebellar ataxia are all associated as issues with movement that rapidly decline over time. The first sign or symptom is problems with coordination and balance. Other signs and symptoms include vision problems, uncoordinated walk, abnormal speech or dysarthria, involuntary eye movement, bad hand-eye coordination, speech and swallowing issues, and difficulty remembering, processing, or learning new information. Lastly, numbness, tingling, pain in the limbs, uncontrolled muscle tensing, muscle wasting or atrophy, muscle twitchiness or fasciculations, tremors, muscle stiffness, and involuntary jerking movements, or chorea, are some more of the signs and symptoms.
The effects of spinocerebellar ataxia has on ones diagnosed with it are very deteriorating. Those diagnosed will start to lose muscle control in their limbs, as well as lack of coordination and balance. The diagnosed will slowly start to be unable to control parts of their bodies, such as their eyes, as well as speaking, and overall being able to support themselves even as an adult. This disease can be fatal due to the deterioration of the body.
Spinocerebellar ataxia is very common. Some statistics about the disease is that it's estimated that approximately 150,000 people in the United States have been diagnosed with this disease. SCA accounts for less than 5% of the ataxia population, and estimated prevalence of 1 to 5 in 100,000. While accounting for only 1 in 20 cases of ataxia, the autosomal dominant SCA syndromes are more common than the other genetic forms. More than 49 SCA forms attributed to at least 37 genes have been identified, showing ethnic differences in their frequency and distribution, with an incidence of 3 per 100,000 in the European population.
There is no cure for spinocerebellar ataxia. However, there are many different options of treatment in order to slow the prognosis. Physical therapy is one of these forms of treatment. Spinocerebellar ataxia is caused by a repeat of trinucleotide DNA, which most specifically affects muscle movement, coordination, and balance. Therefore, physical therapy can help regain movement and stability lost in the body and muscles. Another option that people may try for treatment is mesenchymal stem cells. Stem cells have proven to show some promise and hope for treating neurodegenerative diseases such as ataxia. These types of stem cells are found in bone marrow and help to regenerate cartilage, bone and fat in bone marrow, and skeletal tissues. Spinocerebellar ataxia is a disease either inherited or born with, meaning there is no way to potentially avoid or stop this disease. We're going to show a video now of someone who went through physical therapy to help regain some of this loss of movement in their muscles. So as you can see, after a lot of physical therapy and working on these movements, people are able to regain some of that loss of balance, stability, and muscle movement. Now, I've personally gone through and seen what this disease does to people. It runs in my family, and every single generation has experienced it. And so, me and my sister at some point have to get tested for it. I think that this disease also heavily affects the brain in the way that there's like a stigma around it. And can you think about how having this disease would affect your mental health? Like, my grandfather was so ashamed to use a wheelchair at one point in his life that he would crawl to the dinner table. So I've seen how that affects people, and I think that it's more than just a physical disease, and it also is plays a huge role on your mind and can cause things like such as depression and one day after all of this, if all this physical therapy or stem cells does not work, they will be laying in a hospital bed, unable to talk, walk, eat, do anything by themselves, to the point where um, my grandmother got gangrene and they just let her die from it because they just saw the miserable life that she was spending, not able to talk with anyone. All she could do is just look at the people around her and sit in her hospital bed until the day she died. And this is our works cited page.
So in conclusion, spinocerebellar ataxia is very deteriorating on the body and as well as mental health. Although there is physical therapy and ways to treat this, like said in previous slides, there's overall no cure for it, and people live with it every day. Although it is not as common as other diseases such as cancer, it is still a very serious disease that affects all parts of the body. Um, in a way, it can be compared to dementia with the way of loss of being able to eat, eye movements, and coordination, and all the above with that. So this is our presentation on spinocerebellar ataxia, and thank you for listening.